To tell us more about COVID-19 case management at the Armoured Shield Medical Center is the medical director of the center, Dr. Olushola Oluwole. Dr. Oluwole joins us from the Victoria Island area of Lagos State. Thank you so much for being with us on the show.
Thank you very much for having me.
Okay, so let me start by asking, what confidence and expertise is Armoured Shield and, of course, Zainelab, bringing into sample testing and COVID-19 treatment in Nigeria?
Okay, to start with, as it might have been seen on that clip, the Armoured Shield Medical Center, or the Reddington group as a whole, brings in the perspective of not just treating patients who are infected with the virus, but even assessing those who are symptomatic or asymptomatic, as it may be. So in other words, we have Zainelab, which is a testing center where we collect samples and we test for the COVID virus. And when an individual is tests positive, then we have the option, or rather we have the extra channel whereby we can actually channel that person into our treatment center. And our treatment plans break up into 4. If someone who is symptomatic, rather asymptomatic or very mildly symptomatic, can be isolated at home. Those who perhaps have a little sicker or an older patient or people with comorbidities would then be sent to our isolation center. If they present with even greater symptoms, for example, shortness of breath, inability to breathe, oxygen dependency, then we'd send them to the high dependency unit. If the case gets worse than that, where they need to be on a ventilator, then we have the ICU care.
Okay, so, but I'm not sure if you've heard of this. Some people, have the belief that these kind of virulent and contagious infections are better managed at public or government-owned facilities. How would you allay the fears of those who have these concerns, talking about a private concern or private health facility, managing COVID-19, particularly at Armoured Shield?
Well, for one, as a private institution, as a private medical institution, we adhere to the highest standards of care, international standards of care, actually. Secondly, the Lagos State government would not accredit us if they didn't feel that we were up to the task of both testing and treating patients with COVID-19. Then thirdly, we provide support system to the Lagos State government, as do other medical centers. And in part of that, we have a telemedicine platform so that even those who are at home, for example, who are isolated at home, we have the ability to monitor them from our remote location. We provide them with certain tools to gauge how well they're doing. And if they deteriorate, then we can escalate and bring them into the isolation center. So as part of our network, we also have ambulances that can fetch patients. And of course, we also have a multi-specialty team consisting of intensive care specialists, pulmonologists, cardiologists, people trained in endocrine and renal specialists as well.
Let's talk about the turnaround time for COVID-19 samples. If Zainelab is working on it, what's the turnaround time? Because we've heard some people will have to wait for 1 week, 2 weeks before the results will come out.